Every day, an estimated 2,300 Nigerian children under the age of 5 die due to preventable factors related to poor healthcare, water, sanitation, and hygiene and nutrition. Millions are vulnerable due to diseases, malnutrition, lack of education, and numerous violations of their rights. To tackle these situations, United Purpose and Self-Help Africa is partnering with UNICEF and the government of Cross River State to combat some of the challenges through the Child Friendly Community Initiative (CFCI) project. The project covers 5 thematic areas, which includes nutrition, health, water, sanitation and hygiene, education, and child protection.
In Cross River State, 44.3% of births are attended by unskilled attendants. Half of these children are still being exposed to the risks of vaccine-preventable diseases. These are the service gaps that CFCI is out to bridge in the state.
The poor state of nutrition for children in Cross River State can be attributed to poor infant and young child feeding practices.
I've come here to come and check my children weight. They say it's underweight.
Children in this community initially didn't have birth certificates, but in the emergence of this program, almost all the children in this community 0 to 5 years, they have their birth registered.
So all our children in Letoge, since the coming of CFCI to date, they have been issuing them birth certificate. I am one of the beneficiaries.
Birth registration of under 2 children is one of the most important events in a child's life. It establishes the existence of the child under the law and provides the foundation for ensuring many of the child's rights. CFCI promotes access to clean water through the repair of community boreholes, results of water testing of the available water sources in Wanudu community. The CFCI team undertook the repair of the broken hand pump borehole, which made safe water available to Wanudu community. CFCI project also accelerates pre-primary education as a gateway for scaling early childhood care development.
We don't even have where they can sit and write, but all these desks, tables and chairs, you can see our children are comfortably seated.
UNICEF through CFCI undertook the renovation of existing classroom blocks and equipped same with learning materials. 120 youth volunteers have been trained and engaged to support their communities through the local authorities to improve the well-being of the community, especially children and mothers. The volunteers conduct household visits to make sure that pregnant women and mothers visit the health facilities for antenatal and immunization of their children.
With the help of their mobilization, there's a big change, a nice change since last year that I came here from January.
While the project is still ongoing, a lot of persons have been impacted and expressed gratitude.
Thank you, CFCI!
Indeed, the project is a timely intervention.